What do I talk about? Do I talk about the reimbursement for colonoscopies that's gone down? Or do I talk about people in our own country and in the world that are suffering and don't have insurance, don't have access to health care, don't have education? What is it you're going to talk about? Is it going to be self-serving? Or are we going to take the high road as physicians and say, we're here because we advocate for our patients, and our patients seem to include everybody, so we advocate for everybody. And we want to make sure that everybody has opportunities, that people don't die earlier than they should, that people get the education, that people are healthy enough to complete the tasks that they want. And that's what we're trying to do with our school and our education. And we collectively as a profession should do it with our entire profession and hopefully the nation. Because you know what? We have the greatest gift in the world. It's not that we're healers. It's that we get to meet people from all over. We get to meet people that have had experiences that we could not fathom what to do with. We have people that we take care of that come to us that survive things that you wonder, how can anybody survive that? I live in Coral Gables. But I went into these shelters and I saw a window into a world of poverty that existed in my own country. Because at that time, my plans were, after I finished my training, to go to a third world country where I thought they really needed doctors. Because for God's sakes, this is America. This is where I grew up. What do we not have? What we don't have is that opportunity for everybody. What we don't have is access for so many. Why is it that our next generation of children aren't going to live as long as we are? Because of the disparities in health care and outcomes in this country. You could live in one zip code, you could live in one block, across the street to a more affluent area, and you're given an extra 20 years of life. I don't find that fair. My father's disease, I'm a gastroenterologist. The disparities in colorectal cancer are alarming. If you're African American, you have a 40% higher rate of cancer of the colon and a 25% higher mortality rate. That is unacceptable. So what do we do? The American College of Gastroenterology, we changed our protocols and we said African Americans should be screened at the age of 45. That's great, as a subspecialty. Where was our ethical dilemma? We didn't tell anybody else. Just like we do as scientists. We published it in our journal, we went to the American College of Gastroenterology meetings and we sold it there, we did the protocol and that was fine. We might want to inform people that don't read our journals. I don't know, even if you like British journals, I don't see any of you going out and just buying a magazine called Gut. Okay? So that's where we fail. Because if you're going to be a physician, you have this white coat, and that white coat means something. That white coat should mean values, ethics, that you're the one to look for when they need help, that you're the one that's going to be there and save the world. You're going to take the lead. We as a profession need to do that. And we need to do it for the right reason. And when these students